What is pelvic inflammatory disease? What we usually or commonly call PID. Pelvic inflammatory disease is an infection of the female reproductive organ. It affects the fallopian tubes, the ovaries, the cervix, and the uterus as a whole, and many other organs in the abdomen, including the bowel. It can lead to various complications, especially frozen pelvis and chronic pelvic pain. Pelvic inflammatory disease is caused by a bacteria that cause sexually transmitted infection, especially a bacteria like gonococcal, Neisseria, and chlamydia infection. These are the two commonest bacteria which are involved in sexually transmitted diseases most of the time. Pelvic inflammatory disease can become extremely dangerous and even life-threatening, especially if it spread into the blood system and called what is bacteremia and septicemia, which can lead to shock as well as admission to ICU. What may be the risk factor for pelvic inflammatory disease? Having sex under the age of 25, having multiple sex partners, having sex without condoms, intrauterine device, what we call IUDs for prevention, douching, and also a strong history of pelvic inflammatory disease. What are the symptoms of pelvic inflammatory disease? Painful lower abdominal pain, painful upper abdomen, fever, painful sex, irregular menstruation, foul vaginal discharge, and painful during urination. How can I make the diagnosis, or how can a doctor make a diagnosis of pelvic inflammatory disease? Pelvic examination may also be done by the doctor, which may give a good suspicion of pelvic inflammatory disease. Cervical culture can be done and urine test can be done. Assessment of the pelvis and damage which is caused by pelvic inflammatory disease can be done by pelvic ultrasound, by doing endometrial biopsy, and even a golden standard diagnosis to assess the damage and the extent of damage which is been done by pelvic inflammatory condition or disease is laparoscopy. How can I prevent pelvic inflammatory disease, or how can we prevent it? Firstly, is to lower the risk, which we have talked about. Using protection condom, having a single partner, make sure that you don't engage in sex at an early age, and so forth. To lower the risk, you practice what is called safe sex using protection. Getting tested early for STI or sexually transmitted infection. Avoid douching. Wipe from the front to the back when you're using the rest or the toilet to avoid infection going through your vagina and up in your uterus to your tubes, which can be very, very dangerous. Therefore, bathroom etiquette is very important. What are the long complications of pelvic inflammatory disease? The leading complication or the most common complication we see from pelvic inflammatory disease is infertility. Infertility, because pelvic inflammatory disease is the commonest cause of blockage of the fallopian tube. It damages the fallopian tube, it closes the fallopian tube, and then it makes the path between the uterine cavity and the ovary not accessible. Therefore, because of that, a sperm and an egg are unable to meet so that fertilization can happen and pregnancy can happen. This destroys the path between the uterine cavity and the ovaries, and the fallopian tube is the only connection you have between these two important vital organs. Therefore, because of that damage, a person will present with difficulty in conceiving, or what we can call infertility. You are also have a high risk of ectopic pregnancy due to the scarring, inflammation, and damage to the inside of the fallopian tube. And you can also present with a chronic pelvic pain and a frozen pelvis. Treatment of pelvic inflammatory condition is very important. It's very important to identify the risk. It's very important to avoid and prevent those risks. And it's very important to make a diagnosis early. A mild pelvic inflammatory condition can be treated with oral medication, and then the damage and complication can be avoided. However, severe inflammatory condition will need hospitalization and IV or intravenous treatment and antibiotics and pain medication. All this is medication or treatment to try to avoid damage which may be caused by pelvic inflammatory condition. But most of the time, if you've got severe pelvic inflammatory condition, the damage to the tubes is inevitable. Therefore, it's very important to really understand the consequences of pelvic inflammatory condition. Thank you.